Department has withdrawn its decision to allow special groups to jump the queue for COVID-19 vaccination. The department released a circular that would have seen ministers, deputy ministers, premiers and MECs as well as their direct staff to be vaccinated. But the acting health minister, Mamoloko Kubai, says the circular was not approved by the Interministerial Committee on COVID-19. The department's Deputy Director General, Dr. Nicholas Crisp, is talking to us now here on the Midday View on ENCA. Dr. Crisp, good afternoon. Thank you very much for your time. So this circular has now been withdrawn. So what's the status quo now?
Good afternoon to the viewers. So, I think that there's some misunderstanding about what the circular was intended to do and where it came from. So maybe just to clarify, there have been right since the beginning of the vaccination period, a large number of people who have made submissions that they had to return to their families or return to their work or go back to studies and for whatever reason return to other countries or travel to other countries. It has included companies, people, delegations going to do work in other countries and it has included some government people who have gone to meetings and to delegations abroad. And in some of those cases, the people were not of the eligible age. At that stage, we were dealing with 60-pluses. And so a process was put in place to make sure that it was possible to provide vaccination so that those people could present a proof of vaccination to return to where they were going or to attend the various meetings and so forth.
So it was not about preferential treatment to individuals, but it was about addressing legitimate needs by people or requirements who had to travel for legitimate, for example, business reasons or government business, and those countries would need to show proof. They had to show proof of vaccination. Was that what you were trying to address?
Yes, and if you read the annex to the form, it's quite clear that that's what it's about. We also had a number of people who had commenced treatments abroad for various clinical conditions. There were 2 or 3 who needed to prove their vaccinations to go back for their treatments. So that is what this was aimed at.
So where did the confusion come? So where did the confusion come from?
I think it's badly worded, and I'll take responsibility for the fact it's badly worded because that was
Can I just stop?
Right from the beginning.
Yeah, Dr. Chris, I just want to stop you there. To hear a government department official taking accountability like you've just done, it's a small matter in comparison to other bigger headaches. I mean, it's a breath of fresh air. Well done to you for taking accountability. Badly worded document, and you recognize that, and now you are changing that. But then how are you going to address the need? Because the need you've identified exists.
Well, I think that we'll take guidance because it's caused such a storm. We'll take guidance now from our principals and we'll have a more thorough discussion of exactly what this is intended to do. There's still a public perception that it creates privilege for certain people. And I've tried to argue in the media space even this morning that one doesn't stop the entire economy or the activities of government and of people being, needing to get back to their studies and so on outside of the country lightly. So it's not a question of trying to create privilege for anybody. It's a question of trying to create the ability for people to get back and do what they need to do. And if that is creating privilege or favoring some people over others, well, I think we'll take that criticism too. But that will not be a decision taken lightly considering the storm that has broken over this.
Yeah, but you can understand the storm because we are seeing this Delta variant spreading like wildfire. People are concerned. This vaccination rollout has been slow. It's being ramped up now. So people will have those legitimate concerns. But what are the numbers we're talking about here, sir? What are the numbers of the people who've been knocking on your door to say, I need to go back to study, I've got a business thing, I've got treatment overseas?
I think up to now it might be as many as about 100 people that we're talking about altogether, including envoys of government who've been sent to go and who are under the age were under the age for vaccination, who went to go and try and motivate for vaccines and for other supplies and things. So there have been about 100 people altogether.
So it's not a lot of...
There were 1 or 2 that was...
Yeah, it's not a big number. So,
No.
but the secular, because it was badly worded, and you've recognized that, you've taken responsibility for that, you've taken the accountability for that. It could have opened the door, though, for others to take chances. Would you agree?
Well, sure, it did. So almost overnight, we got a couple of hundred people who were applying through the interpretation that was as a result of the bad explanation, and trying to use it for other reasons to be vaccinated outside of the standard procedures that we have. And I mean, that was understandable, but that was certainly never going to be the intention, and we don't have the capacity to handle that number of people anyway.
Yeah, but can you assure South Africans, as we speak to you now, that door is closed?
Well, doors are closed and open. As I said, we haven't had a chance. We've been busy dealing with a number of other things simultaneously, so we haven't had a chance to really discuss it. And whether it needs to be permanently closed and not allow anybody to travel out of the country, that may not be practical. And it may be that there's still a need to if someone is 40 years old at the moment and doesn't qualify for vaccination in one of the programs, but needs to get back to employment abroad to a country that requires a vaccination, we may still need a policy to do that, but it'll be under discussion now to make sure that we're not doing something that creates even more anxiety.
Yeah, maybe it's going to have to be more clarity and tighter definition of what kind of an exemption, because it could be an exception or an exemption kind of thing, and unfortunately exceptions and exemptions create certain privileges, but if you manage it in a tighter way, it might be different. I was just reflecting as you were answering that last question that you think we can see now the impact of a slow vaccination rollout. Because if by now we had been rolling out fast and vaccinating more people, even those who are under 40 would not be having maybe this discussion today.
Yeah, obviously so that is the big challenge. The challenge is to ramp up the vaccination. And so a week ago we were doing 85,000 vaccinations a day. Yesterday we did 164,000 vaccinations. Our target is to get above 200, above 250, and up to 300,000 a day. It takes the ramping up of the distribution of the vaccines, the increase in the number of sites, the changing of the site, of where those sites are, the physical location of them. We've got a program going, talking to all the higher education institutions to get health students to assist on weekends. There are a whole lot of initiatives. The private sector is busy with a whole range of initiatives to try and increase their capacity. We are now scheduling both insured and uninsured people to all sites so that there's never a shortage of demand at a site. So there are many things that must happen in parallel to be able to reach the numbers we need to reach. Nobody is disputing that we are not ramping up fast enough and we need to move more quickly. We agree with that.
164,000 yesterday.
That was yesterday.
Yes, hopefully it continues. Okay, just final question and very briefly, sir. That whole issue of vaccinating special groups or people who find themselves in a special situation who need to travel but they're not within the bracket that's currently being vaccinated, over 60 or over 50, or Defence Force or teachers and so forth. That particular circular is off the table for now. You are in discussion to see how do you address that need going forward.
Yeah, that's correct. That's a good summary.
Thank you very much, sir. Dr. Nicholas Crisp. He's the Deputy Director General of the Department of Health. I certainly would understand that kind of a predicament, but hopefully they address in a way that doesn't create unintended special groups of privileges for certain people who can misuse it and abuse it.